Dr. Fouzia Shafique, UNICEF's Head of Health in Afghanistan, thank you so much for joining us today.
I'm very happy to be talking to you. Thank you.
And we want to hear about some of the incredible work UNICEF is doing in Afghanistan in health. Start off by telling me, what is the HER project?
The Health Emergency Response Project, often also called the HER project, is a project that is currently helping UNICEF and its partners provide health services, both at the primary healthcare level, which is the basic healthcare, and also the secondary healthcare, which is more specialized care, to all Afghans in all 34 provinces of the country through almost 2,400 health facilities. This project is also helping us make sure that services are available to all Afghans, and to date, this year alone, almost 20 million Afghans have accessed services through these health facilities.
My goodness, I mean, 20 million people is staggering. Who makes it possible? Who's funding it?
So the project is funded by the Afghanistan Reconstruction Trust Fund that has 31 active donors right now, and also partially by the Global Financing Facility through the World Bank, who are working very closely with UNICEF. And then in turn, UNICEF works with our implementing partner, the national and international NGOs, to make it possible to have these 2,400 health facilities functioning through making sure that there are supplies available, that there are health workers present and they are being paid on time, and that there is operational cost to keep the electricity, the water and other functioning of the health facility, so that they are open and able to receive Afghans and provide them the services.
I mean, the numbers are staggering. It does speak for itself, but does it have an even greater significance and even greater importance in the current political context of Afghanistan?
Absolutely. This is a crucial project for the country right now. And the reason is, we're all aware of the economic crisis that Afghanistan has faced over the last 1 year. We know that more and more Afghans are living in poverty. We know there's loss of livelihoods. People have lost their jobs, their work. There's some displacement in the country. Last year alone, we've had a couple of disease outbreaks, measles and acute watery diarrhea amongst them. There were floods in part of the country. There was an earthquake. So Afghans really have had a very tough year and a half. And in a time like this, it's important that services are available free of cost, that they're available close to people's homes, and that they're provided in a way that's culturally appropriate and acceptable to the community.
You've spoken so much about the impact this is having for boys, for girls, for families. Are we missing anything? Tell me what else this incredible project is achieving.
So the facilities I just spoke about, the 2,400 plus health facilities, make up around 60 to 65% of the health facilities in the country. And because they provide services free of cost, many Afghans that might have in the past gone to private sector are also coming to these facilities. And that's why it's important that we maintain the health workers that are there, and in many places increase the number of the health workers, because the number of people coming to these facilities has increased, and that we make sure supplies are available so that Afghans that are facing economic problems, financial constraints, do not have to buy them in the market. And so not just is it important in terms of maintaining the services in the country, it's also important in maintaining the workforce. As you know, many of the educated Afghans, those who had economic opportunities elsewhere, have been leaving the country. And so at a time like this, it's really important that our doctors, our nurses, our health workers, our vaccinators, our community health workers are supported within the country so that they stay and continue to work for their own people.
I mean, it's just compelling, obviously, but nonetheless, those donors who are making it possible, what's your message to them?
My first message would be to thank them. Thank them for maintaining the support that comes to the health sector and not be affected by anything else that's happening, in the region, in the country or elsewhere. And the support has been crucial to keep these services running. So first, thanks to all the donors, the ones that are part of the ARTF and the Global Financing Facility, but others as well who support the health sector. My second message would be to make sure that the support continues, and that not only does it continue to help us provide services, but provide them with better and better quality, right? Make sure that when people come to the facilities, they have a safe, covered, protected area in which to wait. Make sure that the supplies are of highest quality. Make sure that the doctors and nurses get trainings when and as they require them, so that we continue to improve the quality of the services.
Doctor, thank you so very, very much.
Thank you.